Hi everybody, it's Peter Stockdale, the host of the Spin Market Report. Are you looking for a new place to advertise your business? With over 85,000 YouTube impressions and 20,000 total streams across all platforms in the last 12 months, the Spin Market Podcast Network could be the prime space you've been looking for to advertise your business. Get a hold of Spin Market today and see what advertising on a podcast can do for you. Visit www.spinmarketwith2ks.com or email digitalagent@spinmarket.com for more information.
It's the Spin Market Report. Here's your host, Peter Stockdale.
All right, everybody, we're sitting down today. I got Jacob Miller in here. Jacob Miller, you work at Central Iowa Pain and Wellness. And I just want to say, like, this is something that I don't know a lot about. You know, it's every time we bring in somebody here from like anything in the wellness area, I'm kind of just like, I don't know too much about this. But like yours is specialized because you deal with pain and things like that too. Correct. And some of the wellness places are more of aesthetics based, right. You know, so that's going to be the thing that's going to drive this conversation a little bit differently. But can you give me like an outline of the services that you have there at Central Iowa Pain and Wellness? Because maybe they're a little bit different than other places.
Yeah, absolutely. So Central Iowa Pain and Wellness, how we started and what we're based on is using regenerative medicine to help heal the body. There's a lot of old techniques that are out there as far as, you know, chronic joint injuries, back pain, stuff like that, where you can, you know, you traditionally just use steroids, which are chondrotoxic. They're bad for the tissues. They don't really promote healing. So we were looking for an option that was out there that could give a benefit and promote healing, you know, to the joints and the tissues. So that's where PRP came from. My background is in chronic pain management, anesthesia. So this was just kind of a natural progression into taking the skill set and utilizing it to get people really good results and to get them long-lasting results that would be beneficial for, you know, going forward with their life and promoting activities and people remaining well and moving around. You know, we're unique. I do have a C-arm at one of my clinics in Ames, which I can utilize to do spinal intervention. Everything else is done under ultrasound guidance. So, you know, people come in, they do an ultrasound evaluation, and we can see the actual tissues, we can see the tendons, we can see everything, and you can see the defects in those things and actually address it specifically. And it's a little bit better in certain ways than maybe an MRI or a CT scan, because you can go in and you can actually dynamically test it and see where maybe the problem is and go in and treat it. Not only is it just, you know, spine and joint, you know, any soft tissue stuff, but also we do, you know, I spent some time training with Dr. Runnels as far as the vampire procedures, which, you know, vampire facial, you can go in and actually, you can fix scars. So scar revision. So if people have really bad acne scars, stuff like that, you can use PRP to go in and microneedle and actually fix the complexion of the skin. You know, the P shot and the O shot for sexual dysfunction, or stress incontinence, PRP works really well for that. So, I mean, that's another avenue. And people say, well, how does that apply to pain? You know, those kind of things can really segue into painful conditions, you know, that need to be treated. So it does really promote wellness in people and it helps them with their pain in those areas. So yeah, I mean, I think that's where we're different. Yeah, a lot of people out there are using PRP. PRP's been around forever, but actually utilizing it into your practice to get people long-lasting benefit, that's what Central Iowa Pain and Wellness is about. And we want to promote wellness in individuals and actually get them functioning and going out and living life.
Well, what you're bringing up is some of the trends that we're going to, more of the wellness, trying to be much more proactive in areas and not necessarily jumping into a surgery situation right away. Now, that's not saying that might not be needed in the future, but looking at some other avenues on it before going
Absolutely.
that direction.
And that's, a lot of people forget that. They think, you know, that, well, I'm trying to fix them so that they don't have to have surgery or whatnot. Yes, surgery in some situations, like you said, is absolutely indicated, but surgery is also a life-changing event. And, you know, a lot of people think, well, I'm going to have surgery, I'm going to get this fixed, whatever, I'm going to be able to do what I used to do in the past. That's not true. I mean, it can change your life and you can't enjoy things like you used to. And, you know, why not give this a try? It's 100% regenerative. It's actually going to promote, you know, tissue healing. And, you know, it can keep you living without undergoing a major operation if needed. Now, if it can't be helped, then, you know, I'm not in the business of telling people I can't help you. You know what I mean? So, and then you guys have a really good support system here in Fort Dodge with orthopedic surgeons and stuff like that, where there are good resources in the area to get people, good surgical intervention if they need it.
Well, that brings up a really good point about the partnership end of it on there, and understanding that you don't have a problem with saying, hey, we need to bring this specialist in on it. And then you also are working in hospital settings on your other places that you work at as well. Right. So you've got those connections as well.
Well, that's how you're going to get the people the best results, is collaboration and actually working as a team with other healthcare providers to promote wellness. I mean, you can't just treat one area and expect to fix somebody. So you really need to take in all aspects. In my situation with chronic pain, it's physical therapy. It might be hormone replacement therapy. There's, orthopedic surgery if needed. So if it's foot and ankle, podiatry, something like that. So yeah, getting people to the right resources and working together as a team. And even if there is surgical intervention, rehab, PRP works great for rehab. We use soft wave therapy. We use other things to help promote healing and actually get people functioning faster than they would in the past.
Yeah, I like all that, because you actually kind of answered a lot of the questions I had on the first little tier of this, which is nice. I mean, like you guys do have pain management and wellness. I mean, it kind of sets you apart from everyone else in a sense, because you're not just, I want to say like hospitals all do this, but you said you're trying to maybe avoid surgery if possible, or do something aggressive like that. And I mean, I can say firsthand, like I've only had a few surgeries, and only one of them did I feel like I was completely better afterwards, so it doesn't always, like you said, it doesn't always bring you back to 100%, but sometimes it's necessary to make you feel better again. So we were talking about some other things, PRP therapy. That was something that when I first saw it, I was like, what is this? Then I looked at, PRP, platelet-rich plasma, right? Okay, yeah. So can you tell us a little bit about that? Because I've heard about it.
Yeah, so platelet-rich plasma, it's been around forever. It was initially used in professional athletes. There was really no understanding. They understood what was kind of working in the background and what was promoting healing and the things that were contained in platelets, but they didn't understand really a dosage or, how to get things moving and what needed to be put in certain areas to get a certain response. And there's been a lot of, predominantly orthopedic surgeons out there. One in particular, Dr. Buford, he's down in Dallas. He's taken it to a whole nother level as far as, analyzing the platelets, the platelet levels, and then doing a meta-analysis, looking at the literature, looking at his own personal results to find a good dosage as far as what you need to get good results. So there's a lot of people, I wouldn't say a lot, but there's a fair amount of people that offer PRP therapy, but their dosages are way below what's needed to actually get a beneficial result. So at that point, you're just taking it out and you're basically putting your baseline platelets, maybe 2 times concentration back in, and you're not really getting good results with it. So, I mean, it's very important to establish that baseline and then build from there and give an appropriate dose depending on what you're trying to treat. Now, PRP therapy for facial stuff and whatnot, is dosage is important? No. But PRP therapy, if you're treating joints or anything like that, there's different things that you look at as far as what you're trying to treat. And that's, we're a little bit different too, in the sense that we offer, you can do what's called leukocyte-rich rich plasma, leukocyte poor. We also do platelet lysate, which is where you take the platelet and you basically rupture the platelet, and all the stuff that's contained inside is readily available. You run it through a very, very small filter, and then you have what's called platelet lysate. You haven't altered the blood. It's still the patient's blood and platelets, but you've removed the proteins from it. So you can put it in around nerves. It works a lot faster in tendons. So you can get a faster response because the body isn't having to break down that protein that's protecting the platelet. Everything is readily available. So when you put it in there, you're going to get a response a lot faster. And it works a little bit better for tendons, ligaments, stuff like that, or nerves, in the spine. You can inject it. You can actually do an epidural injection of it, and it will help resolve a disc herniation. It works really well for, post-surgical pain, back pain, and stuff like that, as far as getting people reduction of their nerve symptoms. So there's a lot of different things that we can do. And I think that Central Iowa Pain and Wellness, I know we're very unique in that aspect, that we do offer PRP lysate that can actually be used around nerves and stuff like that. So
that's wild. You go back 20 years and it's like, this wasn't even on the horizon of things that people were really doing. And now it's like, you're doing what now? This is crazy, Yeah.
I'm just, while he's talking about it and all the different ways that they can do it, and using the individual's own blood, which is much better anyway on it, and what the results are. I mean, it's mind blowing.
Yeah, it's a lot of fun. And, it's the main thing is, And I see a lot of younger athletes that come in and, they might have some tendon strains or ligaments, whatever. And if you can go in and diagnose that, I mean, there's a lot of really good young athletes in the area, and you don't want to go putting steroids in these individuals at a young age. And if you can avoid surgery, absolutely rehab these people so they can get out and perform to their high level. So, looking at, early teens, 20s, 30s, I mean, there's a lot of competitive athletes in the area too that could really benefit from these. And not only PRP, but soft wave is non-invasive, reduces inflammation, promotes tissue regeneration, stuff like that. So it's a really good resource, and it's just getting out and educating people. And that's part of why I'm here today, is just helping people understand that, you can actually use your own body to heal yourself. And, the turnoff is insurance doesn't pay for a lot of it. So people think, well, if insurance doesn't pay for it, it must not be appropriate. It's been around forever. And I use the analogy, I'm like, well, healthcare has advanced so much. So you take, what we're doing for current soft tissue injury, stuff like that, injecting steroid, doing these things. This is what they were doing 40 years ago. You would not want to take a cancer treatment from 40 years ago and use it for what they're treating today. It has advanced so much, and we're just so far behind on treating different aspects that, why not use something that is a step above. I mean, we're using technology, research, everything that's out there. It's better understood, so why not use it? So I guess that's another thing, is just it's superior in multiple ways to what has traditionally been done.
Well, I think you're going to see the insurance companies moving over to that more and more as you keep educating everybody on it. It's like you just said, 40 years ago, what they're paying for now may not have even been paid by insurance at that time, but it's
So I mean, it's just getting the education out there and letting people know that it's available and that it can help. Another area like soft wave works really well for treating peripheral neuropathy. There's really not a lot of good treatments for peripheral neuropathy, but you can use soft wave. And we've had people come in that can't even feel their feet, and we treat them with this and they can feel their feet and they're walking again.
Do you want to tell us what peripheral?
Yeah, so peripheral neuropathy basically is it's just in a simple way, it's damage to the nerves in the feet predominantly. It can be caused by a number of things. People that spend a lot of time working on concrete, and just repeated trauma to the feet can cause damage to the nerves. There's a lot of metabolic issues. Diabetics tend to have a lot of it just because the microvasculature of the foot is impeding blood flow to the nerves, and they just get nerve damage and micro nerve damage and stuff like that. But it feels, people say it feels like pins and needles, or it feels like walking on Jello, or just stuff like that. But in older individuals, there's not a whole lot you can do, but not having that balance makes them more susceptible to falls and injuries. So, I mean, it's just another way of promoting wellness in people and keeping people moving, and being able to feel your feet is really important.
Yeah, absolutely. Yeah. I one of the things you'd mentioned earlier was the vampire procedures. I mean, I saw on your website that you trained under, was it Dr. Runnels?
Yeah, so Dr. Runnels, yeah.
Okay, so what are these procedures? Because you mentioned it earlier, but I don't really know a whole lot about those either.
So Dr. Runnels does a lot of them. He's patented the vampire thing. And what it is basically just vampire because you're using your own blood. So that's his patented term for it. There's a lot of different things out there. He does a vampire facelift, which where you go in and you put filler in and Botox, and then you also do PRP to the skin, helps lift things. We can use PRP under the skin to help with dark circles under the eyes and stuff like that. You can actually warm up the PRP and turn it into a gel that's very similar to a filler, like that they would use, in aesthetic studios, but it's actually using your own body. It doesn't last as long, but if you wanted to use your own body and you didn't want something synthetic, that's an option. I've kind of, I learned that part. I really don't do a whole lot with it, just because, women like their faces. That's just not my wheelhouse. So I'll leave that to people that do more of the aesthetic stuff so that people get really good benefits, because nobody wants, funny looking face, obviously. But yeah, the vampire, and then the vampire facials, I do those, if somebody comes in and they're like, hey, I have scarring, or they just want a better complexion or something like that, you just use PRP and do some microneedling to the face. It can reduce the scarring, promotes collagen, it tightens the skin, it just makes you look younger and more vibrant. So that's another, that's one that I do often if needed. The vampire breast lift is actually using PRP to lift the breast tissue. And Dr. Runnels recently, I don't know if there's any publications on this, but he suspected that PRP might help reduce the incidence of breast cancer because you're using it, but I don't know about that. But anyways, the breast lift is using PRP, and it causes, hypertrophy of the fat cells a little bit, so it can lift the tissue and provide fullness to the breast. So that's one that it can be used in that area. And then I already brought up the P shot and the O shot, which is for, sexual health and sexual well-being, stress incontinence in females, stuff like that. So
that's really interesting, because a lot of this is like what you're talking about is it's almost like holistic in a sense where you're using yourself. I mean, to heal yourself. You know, it's maybe not like 100% what would people would call holistic, but you're not using medicines to do it. So that's really cool. I mean, I like how you used the term synthetic versus maybe organic from yourself. So. All right. So are these like most of the common conditions you treat, which would be like just the pain type things then?
I would say most of them are, predominantly knees. So a lot of people have arthritis of their knees, or they might have, a meniscal tear or something in their knees. Foot and ankles, another big one. A lot of people have pain with their feet, and we abuse them. We're on them all the time. Shoulders for sure. And then back, a lot of back injuries and stuff like that, where people just have a lot of low back pain. All of them can be, hips. We can evaluate hips, but a lot of them can be secondary. You might have knee pain that you think is coming from your knee, but it's coming from your back or whatnot. So that's where, my background in chronic pain management, as well as this, come in, do a very good, thorough, free consultation and evaluation to try to find out and identify where the primary pain source is. So it might not be that it's just coming from your knee. It might be coming from your back or in your hip. It might be coming from your sacroiliac joints. The good thing about this is that there's no restrictions as to how much I can treat. So let's say you come in and we do think it's your back. So maybe you have some arthritis in your back. So we treat the facets, the arthritis in your back. And then maybe you have a sacroiliac joint, which is where your sacrum meets your pelvis. There's a joint there. Maybe you have some inflammation in that. I can inject both of them. There's nothing that says that I can't. Whereas in a traditional setting, you would be able to only treat one area that's approved by insurance. And you might not get the relief that you could get because the pain is also coming from someplace else. So that's the benefit to doing regenerative medicine, is we can treat multiple areas too at one point in time and get you good results just with one treatment.
You brought up a good point. That's the benefit of possibly having this not be insured fully,
Exactly.
or because like you said, I remember going to the doctor sometimes and they'd be like, well, we're going to do this because this is what the insurance company will approve, or this is what they will like to see, on the report that we give them. And it's like, I never really thought about that end of the job, but with yours, it's not necessarily something you have to think about as much.
So you actually can treat the patient. It's nice because you can treat the whole thing. You can identify it and treat all the areas, which gives the patient the benefit, because you can go on and you can recover a lot faster instead of wasting your time and coming back in and whatnot. So.
Yeah. I mean, like they're just like, oh, this is the symptom, so we have to try just one thing, and if that doesn't work, then we'll come back and try another thing.
Exactly.
I mean, it kind of makes sense from a cost structure from an insurance company, but as far as like people feeling better at the end of the day, it doesn't really make a whole lot of sense. Yeah, I like that. That's good.
Well, and I think Peter brought up a really good point with that, as well as if you don't feel well after a procedure, they may not be as willing to go through it again. Their whole mindset, attitude, everything is not necessarily in the best situation if they're not seeing any improvement.
Yeah, because they have both wellness and finances, in mind. Whereas a lot of times when we go to the doctor or go to somebody for pain management or something like that, all we really want to do is feel better at the end of the day,
Right.
So
yeah.
So I got something on here. We're going to shift gears just a little bit. So how do you stay connected with the community that's around you? Because I do know that Central Iowa Pain and Wellness, you have 4 locations?
Well, we have 2 main locations, and then maybe just the Ankeny one we're not there anymore. So, and then Pocahontas, work closely with Dr. Jake Rickers at his chiropractic place. So if he has people up there, I can go in and do consults and stuff like that. Carrying the equipment around just gets a little bit clumsy when you're bringing an ultrasound and a centrifuge to process blood and stuff like that. We did that. It's just a lot of work, and it's not the best for the patient. So doing consultations is one thing, and then we'll either have them come here to Fort Dodge or have another clinic in Ames to treat those areas there. So in Ames, I do have the C-arm, so the fluoroscopy, so I can utilize that to do spine, or even if I wanted to do some joint stuff with it, I could. But that's not mobile. But the other ultrasound is, and you can be very accurate with ultrasound injections. So, yeah.
Yeah, I think that's one of the funnest things about, some of these wellness places or pain management places or like the healthcare in general. It's changing now so much where you can be in multiple locations in a sense,
Right.
On these days I'm here, on those days I'm here. If you need me over here, I can come to this office. We kind of share it,
Right.
That's really nice. It used to not be that way. You had to go to the doctor's office, next to the hospital or whatever it was, to go do your thing, that.
Yeah.
I mean, maybe not be, again, the most conducive, but at the time it worked out.
It was what it was. That was how medicine was handled.
Right. And, you talk about the community, and we're in rural Iowa. It used to be that if you needed to get something, you had to go to Des Moines or you had to go to Sioux Falls or whatever. So, part of what I do is I like bringing these things to rural communities so that they have options.
Yeah.
Because it's very hard for somebody sometimes to get in their car and travel 3 hours. So if you can bring these services to them or bring it to a location that's even closer, then you're helping promote wellness in these areas that, I don't like using the term underserved, but they don't have as many resources as they do in the bigger cities. So it's nice to be able to have that as an option for them. In the community, it's anywhere we go, and here in Fort Dodge or Ames or whatever, it really is promoting wellness. So opportunities to promote wellness. We haven't even been here in Fort Dodge for even a year yet. But activities that sponsor or support promoting wellness in even younger individuals. Like I said, there's a lot of young athletes. So getting out and educating athletes that, hey, you have other options than these available to you, because they might have, 10, 15, 20 years of performing left, and one thing can sideline that and really ruin it for them. So just being able to promote wellness and fitness within the community is something that's very important to us.
Absolutely. So do you have any like partnerships or initiatives that the company is involved in that you're particularly proud of, like things that you're like maybe events you go to or things you've like helped set up or partnered up with another company to try to, like you said, promote wellness?
Yeah. So far, we talk about Jake Rickers up in Pocahontas. He does a very good job of utilizing a holistic approach, treating individuals. He's a chiropractor, but treating individuals holistically within the community. Also, Med Spa in Pocahontas, they do a very good job of supporting the other side of it, even chronic pain, but it's the hormones and the wellness part of it, taking the internal medicine part of it too, and looking at that and examining that. So as far as partnerships, we're very young still, but we're just continue to develop those partnerships. I have a close relationship with some individuals down in Arizona that work with professional sports teams. So I have them available to me as a consultation, so I can, sit down with them and be like, hey, what are you seeing in these more progressive areas? What are people doing? How can I bring that back here and promote that in the area and provide better results for individuals? So it's continually learning, but it's also, like we talked about earlier, collaboration with, individuals that can bring different points of view to how to treat these things.
Yeah, you brought up sports twice now, and it makes me think, that's where a lot of the innovation comes from, because, let's be honest, that's where a lot of money's at these days. So, that makes sense, having somebody like that in your back pocket to say, I'm noticing these things. What are you noticing? Have you tried anything different that worked? And maybe you can apply it to your patients.
Yeah, because it's continually evolving. So it's staying up with it and keeping up with the research and collaborating with those people.
Well, I love your comments about networking and reaching out to others out there, because that's huge. And I'm a big advocate of that. Everybody here in the office will tell you that I'm always saying, hey, you never know what you're going to find out by meeting somebody, by going someplace, running into somebody. Yeah. And that's so important.
Yeah, that's marketing. That's what that is.
It is. It's marketing.
A lot of people don't think of networking as marketing, but if you don't know anybody, then where are you at? You're just stuck right where you're at.
Yep, absolutely.
So let's shift gears a little bit into marketing. So have you tried any marketing strategies or found any that are most effective for you?
So my wife gives me a hard time because I'm very old school. I'm not very good with social media. I try to stay out of it because it takes so much time. But, social media is one aspect that gets a lot of attention, but it's also, there's a lot of noise. There's a lot of background noise. There's a lot of people out there saying other things or, just pushing other avenues. And it's hard I would think it's really hard as an individual to be like, all right, well, at this point, what's true, what's not? Mm-hmm. So it's just getting factual information out there. But yeah, social media is a good avenue. We have put on some events, where we've sponsored some events, or we go to maybe business openings, or I don't know, we went to a half marathon down in Des Moines and stuff like that to just kind of get out there and market, and so that people can see, hey, we're here, this is what we're doing. But yeah, as far as marketing goes, that's really what it's been so far. We've tried, a little bit of radio advertising, stuff like that I don't know if it just didn't work that well, or if it's, people are in their cars and they're driving and they're trying to write down these phone numbers and stuff like that. I don't know if that makes radio marketing, but yeah, social media and just marketing in general, I would say that's probably where the majority, and word of mouth.
Yeah, word of mouth.
Word of mouth's a big one. Yeah.
Yeah. That's like a cousin to networking.
Yes, exactly. Well, and doing podcasts like this.
Oh,
so
yeah.
that it's coming, the story is coming directly
Right.
from you, and all the ways that you can use it. And Peter will, be very helpful after this is all done, getting you things that you can use now and in the future, so that you make sure that the right message is getting out there.
Right.
And you become the expert.
Right.
Versus the other people that are.
Yeah, I mean, like you said, social media, sometimes it's just like, how do I know this person is an expert or not? And one thing, it'll be coming up in an upcoming podcast episode, but we talked to, actually, believe it or not, a bunch of high school kids about what's the difference between social media and a website, what's more important. And believe it or not, even they said, sometimes if you go on social media, it's like, this is really neat, but you got to go to their website to see where the official information is.
Right.
There's no noise over on the website.
Right.
This is just your stuff with your factual information, your history, your about, what you can do, the services you offer. I mean, that's where all the real data is collected, is on the website. And I did notice you do have a website, centraliowpain.com. Yeah. I'll have a link down below for anybody. But that's where I drew a lot of this information, a lot of these questions from, because there's a lot of interesting information on there, Yeah. So I did also pull some off of your Facebook as well, because
that's fine.
The social media is really good there too. So even though you were humble about it, you do have social media presence that's out there.
Oh, well, that's good. That's good. I'm glad my wife does a good job with that. So
I can say there'll be links. There'll be links down below if you guys want to check it out and follow it. So I was going to ask you about using social media, but we did kind of cover that with like how this all works out. But let's see here. Are there any challenges you face when you try and serve the public? Is it one of the things I was thinking while you were talking about that was the noise from social media? That might be like the biggest challenge. What's real, as everything, like we said, in the healthcare industry is changing so much. Right. That might be one of them. But are there any other challenges that you're facing?
I would say the other challenge is, one, educating, getting people out there and actually getting in front of them, like you said, podcast, but getting them to listen, because PRP has been around for a while and it has evolved. It's changed. It's gotten better. And there's a lot of people out there that have had PRP treatments in the past and they didn't get good results. Does that mean that it wasn't effective? Not necessarily. It just means that maybe it wasn't an appropriate dose, or maybe it wasn't in the right spot, because there are a lot of people out there that just do blind PRP injections in joints and stuff like that, that they might not be in the right spot. They might not be addressing the specific injury. So educating people, getting people to give it another chance or to come in, because a lot of, you might have talked to somebody and they said, well, I had that done, or I know a cousin in Kentucky that had it done and it didn't work. Well, yeah, who knows why it didn't work? There's multiple reasons. And that's why we like to do free consultations. We like to get people in, just sit down and talk to them, because talking to people, it really provides a lot of benefit, because you understand their goals too. So that's treating pain is more about just treating the painful condition. It's about sitting down, listening to the patient, finding out what they want, what motivates them, where do they want to go with it. And so I would say, a challenge is getting people in to just listen and educate them. And whether they decide they want to do it or not, it doesn't matter. I mean, it's just sitting down and educating people. But as far as pushback, no, there really hasn't been any pushback, because it's just, it works. And it's the people that have had it done, they enjoy it and they're glad that they did it. So
I think you brought up a good point too about like when you do a consultation, what's the objective? What are they trying to get out of this? Do they want to run a marathon after this, or do they just want to be able to walk again? Those are two very different goals to get out of something. And that's, I guess I never really thought about that, So that brings me to the next question. How important is feedback when you try and shape your results that you're or trying to figure out exactly how well things worked? How important is feedback?
Feedback is very important. And we use a thing called data biologics, which looks at, you put in patient information, you put in what you did, what the injury was, and it tracks all this stuff, and it gives you an idea of what's working and what isn't. Also, patient feedback, they get sent surveys every 6 months, 12 months, because PRP is unlike anything else, that it continues to get better over time. Obviously, there's a threshold or a plateau where it's not going to work anymore, but it lasts months. So, getting feedback from patients 6 months, 12 months down the road is very, very important as far as figuring out, okay, well, this is the dose or the amount that we gave them, and this was what their disease looked like at that point in time, whether it be arthritis or a tendon tear or a ligament or whatever, and this was the outcome. So sometimes, I take it personally when they're like, oh, it just wasn't quite as good as I thought it was going to be. Or, maybe it's changed a little bit and I'm like, oh, well, maybe I missed it. That's not necessarily it either. It's just, but yeah, patient feedback is super important. We want to get patients the best results we can. And the patient is the important part of that. And feedback is very, very important.
So that's for services, but how about for like marketing now? Let's shift the gear a little bit to marketing. Does patient feedback help with marketing at all?
Oh, absolutely. So, I mean, the ones that come in the door, like I said, just getting people in to educate them or to do an assessment on them, finding out how they found out about us, stuff like that is invaluable, because you want to continue running with that, because overcoming that obstacle of getting people in and educating them, that's one of the main limiters in this or limitations in this business. So if I can figure out how to get to people, and the only way to figure that out is to have them tell me how they heard about us.
Yeah, absolutely.
Yeah. Well, it goes back to reputation management. When we're with our clients, we're talking about getting reviews and getting legitimate reviews, not paying for them, which is illegal. And, but getting those real testimonials and getting comments, not only from the individual that you are taking care of, but maybe a family member,
right?
Because they're going to, say, hey, what changes that they've noticed, not necessarily on the physical side, but maybe within the family situation as well.
Right.
How did you end up getting involved in this? Was this something that from a young age you were just like, I'm going to be involved in pain management and wellness, and this is what I need to do, or did
in
you
kindergarten he came up with that?
Yeah. Or did you have a career path and kind of shift gears to this?
A little bit of both. So, I remember I was thinking back to high school, and I did a presentation on pain. I remember doing that in high school. And then, kind of transitioned, and I had a degree in biology and chemistry, grew up in Kansas. And then I shadowed a nurse anesthetist when I was a junior in high school, and he was doing pain management at the time. And he was even incorporating acupuncture into his pain management. And I thought, wow, this is in a rural town in Kansas. This is pretty impressive. And patients were getting results, and just the science behind it and the fact that you can really help people live better lives was kind of mind-blowing to me. So went, got anesthesia training and whatnot, and it was still kind of there. It was like, all right, pain management. So went to South Florida, did a fellowship in chronic pain management, and then was just doing chronic pain management, traditional pain management, epidural steroid injections, joint injections, ablations for, arthritis in the back. And I just, in the back of my head, I was like, there's got to be something better. There's got to be a way that I can get people better results, heal them, and get them to live better lives. And I was thinking, PRP, you're using your own body, you're using, what you're getting, and the research is just evolving, and people are getting better results and better results. And I was like, all right, eventually I said, I got to jump. So I just jumped. I was like, all right, let's take the chronic pain management. I have this skill set as far as the injection side of it. Let's take the science, let's put it together, and let's start promoting wellness. And that's what turned into Central Iowa Pain and Wellness.
That's a good story. I like that.
Isn't it though?
Yeah.
Well, and also, you're not originally from around here?
No, I grew up in Kansas.
And what brought you here?
Well, I came up here and worked, and then, just
and you liked it and you stayed?
Yep, I'm in
All
Iowa.
Right. I love it. Yeah. I love it.
Yeah.
So what's the most rewarding part of the job for you?
Patients. Yeah, absolutely. When the patients come in and they're like, I'm pain free, my shoulder doesn't hurt anymore, anything like that. I'm able to enjoy activities. That's one aspect that's very, very rewarding. There's another thing, that we're going to try incorporating. It's called a stellate ganglion block that you can use to treat PTSD, or using the PRP lysate. There's some studies out there that might support using that for neurodegenerative disorders. So Parkinson's, dementia, stuff like that. So it's continually evolving. And if you can treat people with these chronic nagging conditions, we've had people that have come in with long COVID from the COVID vaccine, and that's a whole nother area. But, if we've treated them and they've gotten results, they've gotten improvements in their lives, and they can function. And I think that's probably the most rewarding part of it, is watching people get their life back and being able to move forward with things, because a lot of people might have been dealing with this pain for years and they feel hopeless. They don't feel like they have any options. I was out in Las Vegas at a conference out there that was taught by Dr. Buford, and I was sitting beside an orthopedic surgeon that practices out in California, and she does a lot of spine intervention. And we were just having a conversation about, how bad does the spine have to be before this works, trying to figure things out. And she said, you know what, I see a lot of people and they come through my doors and they say, you are my last option. Now that's a lot of pressure, but also it gives me a sense of pride to know that they trust me enough to come to me. And it's a lot of pressure, like I said, but yeah, if I can get that person results where they don't have any other options, they're kind of, they've given up, then that, to me, that's what it's worth. And it's, I put a lot of energy into that, and I want to really promote wellness in these people and try to help them as much as I can. And that includes collaboration. You know what I mean? Like there's a lot of things that may have been overlooked, and then that's not my specialty, but I know people that can probably help them with that and change certain aspects. One of them, I talk about hormones. Hormones contributes to chronic pain. It also contributes to a lot of other things, fatigue and just your overall sense of well-being. And if I can get somebody in the right direction or get them to the right person that can maybe balance that stuff out, then, that's going to improve their quality of life too.
Really, I really appreciate that partnership with everybody, because you can't know everything.
Right.
And bringing somebody else in, and sometimes the fresh eyes.
Absolutely.
There. And we talk about that all the time. Somebody's been working on a website forever and, hey, brings in another one of the staff members to, will you look at this? What do you think?
Yeah.
Those fresh eyes and that fresh knowledge can be huge.
Yeah, the end result is for them to live their life again.
Right.
I mean, you brought it up earlier. If we live in kind of a rural area, and if these services weren't here, somebody who has back pain might have to sit in a car for 3 hours to drive, and that's
absolutely.
And when we think about pain management, I mean, if you've never been in pain for a long period of time, you don't really understand it, but it kind of rules your life.
Yeah.
I mean, my back hurts. There's nobody here. I'm not sitting in a car for 3 hours. I'm just going to deal with it. And that's the end of it, And that's how in areas like this, for a long time, surgery was the only option, or, an intervention of that might be a little bit more aggressive, So that's where I think, like you said, it might be the most rewarding thing is watching people get their lives back. Right. We had talked a little bit about like networking with other people. And I think that might kind of lean into this next question is staying current on advancements and technologies that go along with pain management and wellness. So what are some other avenues that you do? I understand networking is probably huge. Like you said, having somebody in your back pocket in the sporting industry or something.
Yeah. And there's always, there's a lot of literature coming out, and most of it comes out of Europe and other countries other than the United States. But there's just, staying on top of the literature, reviewing the literature and altering practice. That's probably that, and networking, what people are seeing in the field is more beneficial than what's, reproduced in a lab, basically, because there's other factors. We talk about that, the hormones or whatever. You sit down and you talk to these people that have a lot more experience than you do, and you say, all right, well, this is their background. This is what's going on. How does that fit with this? And then they can give you feedback. So I would say networking is huge, just staying humble. That's a big one too, because understanding that people, you're treating a person. So don't just treat the disease, treat the person, and then using those resources. And if people give you feedback, don't take it personally. Don't be like, oh man, I missed that. Just say, oh, wow. All right. That's what it's going to take. Maybe that's it.
Learning opportunity right
yeah.
there. Yeah. I mean, that's, like you said, staying humble. I think it leaves you a little bit more open-minded to being like, oh, this didn't work. Why didn't it work?
Right.
What can I do differently? What can I do for this person? The next person that comes in with this, et cetera.
So I know that didn't exactly answer your question, but staying up to date with research, networking, and using the resources is really how you stay on top of it.
Well, and you bring up a really good point in communicating and asking questions to get answers back.
Right. And
sometimes you may not even know what direction you're going with your questions that you're asking your patients, but as they respond or say something else comes up and you're going, okay, that is the key that we're looking for. That's the direction we need to go or whatever. So actually my kids always say that I ask way too many questions, but that's how I operate, is asking questions and getting answers back.
Yeah.
And helping me figure out, okay, what direction do we need to go?
Right. There's a lot of times that I get done seeing a patient, I may be like, oh, how was your Thanksgiving dinner? Well, Thanksgiving dinner was great, but I was, I bent over to grab the turkey out of the oven. Then all of a sudden I felt this pain and it kind of nagged me the rest. Oh, okay. Well, you didn't tell me that when I was talking to you originally, but I just gained insight just by having a casual conversation with you. And I had a mentor when I was doing pain management and growing in this field. And he said, just listen to the patient. The patient will give you 99% of the answers to what you're looking for. And that's just it. You got to listen. You might get a diagnostic study that says this, but you look at the patient and you assess the patient and you listen, and it's not even close to what's, so you would be chasing something that's not even their main pain generator.
Yeah, you brought that up right at the beginning. Oh, my knee hurts, but like maybe it's because your back actually hurts. And you don't notice it because your knee hurts more. Right. It could be something as simple as that, or as complex as that, even. All right, so we're getting close to the end here. If you could give like one piece of information to somebody that's maybe looking to get into this industry or this field, or just starting out in it, like what would be the piece of advice you would give to them?
Use the evidence, use the research, review the literature. And make sure that you're using the best that you can with what you have. I guess if you're getting into the business, if you can, even if it costs a little bit extra money or it's a little bit more of an investment, remember you're dealing with people. So give them the best that you can give them, I guess would be the biggest piece of advice that I can give. Just do your best for them and be there for them and help them get the best results.
Customers, clients, everybody's people. It doesn't matter. Like, so any service, it's like, why wouldn't you want to do the best for them, in any industry? So, that makes a lot of sense.
Yeah. Well, and I would add to that again, don't be afraid to go out to different places and learn different things, get different resources, because that's where you start to get, okay, what question do I need to ask? If they were coming to you and saying, okay, what do I need to do to get into this industry or this medical profession?
And I think that you guys spoke on it too earlier about just not holistic, but more of a functional medicine. Whereas we're kind of transitioning into that. Everything has been compartmentalized in medicine and healthcare in the general. It's like, oh, you go to physical therapy does this, and you go here and here. But the more you collaborate with those people and the more those relationships are built, the better patient outcomes you're going to get. And I think you're going to start to see more of a transition into that kind of a care model where people are collaborating, and you go someplace and you might have 3 or 4 resources available to you that can get you better results. So
exactly.
Can you name a time in your life where marketing impacted you and maybe you didn't realize you had been marketed to, or it impacted you until afterwards?
I always thought of marketing, and this is exactly what marketing probably is, and not in a bad way. I don't mean this in a bad way at all, but it's kind of tricking you. So I always thought it as a challenge. I was like, all right, what's their angle on this? Why are they trying to, where are they trying to get me? So I always thought it was a kind of a challenge to ignore it. But then once you get into business, that's because I wasn't in business, and you don't understand that, marketing's not real. They're not trying to trick you. They're trying to educate you. They're trying to get stuff out there. They're trying to promote something, which is the point of marketing. But, recently, the one thing that I can think of is this soft wave treatment that we use in our clinic. So they do a very good job marketing on social media and stuff like that. And when I first saw it, I thought, this is voodoo. There's no way this stuff works. And I don't know, people say your iPhones are listening to you all the time and social media and all that stuff. So it kept popping up. And I was like, all right, well, I'm going to start doing some research. So then I started looking up research articles, particularly to soft wave. And then, so I would say that would be an area. And then, but it led to a good outcome because it helped me make the best decision on the best piece of equipment to get my patient the best results, if that makes sense. So just their little marketing thing that I was trying to get around and say, oh, they're trying to trick me. What are they trying to sell? This thing's voodoo. It's not going to work. Led me down the path of investigating it, researching it, and finding something that was super beneficial that I probably wouldn't have thought of if it wasn't for marketing. I don't think it would have came up, because when you search shockwave therapy, there's so many different devices out there and stuff like that. But in this particular case, somehow this particular device showed up and it was beneficial, and the patients are the ones that get to benefit.
I never thought about it until I was in marketing, but you're exactly right. There were so many times when I was growing up where I was like, don't market to me. I'm not buying that just because you did market it.
Right.
But at the same time, when you grow up and you're like, oh, I'm so glad I saw this commercial, this trailer for this movie. Now I want to watch it. Well, guess what? That's marketing.
Yeah.
So
Yeah.
So my brain tricked me into be like, well, if it's something I enjoy, it's not marketing.
Right.
You know, that's just a company informing me on a product they have that I'll actually enjoy. But if it's something I don't want, I'm just like, don't market to me with that. But that's right. You're just trying to get your information out there to your client base, really, is what it is.
Yeah. And I didn't understand that until like I got in this situation, and it's more of educating, and it's more of, there's different sides to marketing, I guess, too, you know, what you want to be in. But yeah, it makes a huge difference.
Well, I was just going to bring up when we were at the job fair on Wednesday, and we were leaving, and they said our booth was the most.
Yeah, it's like one of the most visited
booth and on there. But what we did is we brought out the mobile podcast and let the students talk. And it got them enthused and everything. And as I was leaving, I said, well, that's what marketing's all about. You know, it was a case of bringing out something that interests them. And then Peter was doing such a great job asking questions. I mean, they were lined up. He had 2.5 hours worth of.
Yeah, there's like 50 some students we talked to or something like that. Yeah. Almost
I mean,
60.
They were fighting to get in there to do it, and it was totally innocent on our part, just, you know, bringing out the equipment out there so they could see it.
Well, again, from our aspect, it wasn't necessarily like this is going to be a great marketing angle. We were just like the day before thinking to ourselves, it would be if I was a student, this would be fun to stand in front of.
Exactly.
Right. It had nothing to do with like, oh, we need to bring people in and do that. But at the same time, it worked out really well because, and that's like you said, if it's something that interests them, it's not really marketing. You're just informing somebody. You're giving them an opportunity. You're
educating them because they thought it was so cool to hear their voice and what it was going to sound like on the podcast and how they went. And so.
That's good. Jacob, I want to say thanks. Taking time out of your day because obviously you're busy. I mean, you have different locations. You're traveling. You're traveling around. This is one of the things where we had to schedule this out on a time where it would work best for you to come through town. Absolutely. But I want to say thank you. CentralIowaPain.com, all the social media, all the links, they're going to be right down below. So if you want to check them out, go ahead and click them. And share this episode with your friends if you enjoyed it.
Exactly.
Perfect.
Thank you.
Thank you.
Yeah, thank you.
This podcast is produced by Spin Market and Digital. Located in Fort Dodge, Iowa, Spin Market's highly skilled team can help you increase your market by updating your website, improving SEO, designing advertisements, and producing podcasts that will grab the attention of your market. Contact Spin Market today for all your digital marketing needs at digitalagent@spinmarket.com or call us at 515-302-8026. And to learn more, visit our website at www.spinmarket.com. That's digitalagent@spinmarket.com or 515-302-8026. Or visit our website at www.spinmarket.com.